Welcome, guys. We're going to do a little sit down with Dr. Phil Wasicek. He's our new plastic surgeon. We're super excited about having him on board. And one of the things that's really important when I think our patients are thinking about plastic surgery is a little bit about training. Like, how do you become a plastic surgeon? And it was kind of funny because I'm not sure this was intentional. We were super, super impressed with who you were as a person, but part of your background is Harvard. Part of my background is Yale. So it's that interesting kind of like Harvard Yale rivalry. But what was interesting also, I thought, is I'm an old man. You're kind of the younger generation. And there's almost 15 years between our training. And so when I was an intern at Yale, there was no such thing as an 80-hour work week. There was no such thing as kind of this thought about well-being or work-life balance. Is all about kind of pounding surgery into you and making sure that you are this most hardcore surgeon around. And there are pluses and minuses to that. And again, as an old man, I kind of think about all the pluses, but not all the minuses. Can you give me a little bit of background on kind of how you see kind of the old days vis-a-vis what your like experience was as an intern?
Sure. So I was an intern a while ago, still
Sure.
not as long as
Hey.
you, but not to say anything about you. But almost 11 years ago, a little bit over 11 years ago, I became an intern and a doctor. And I guess I don't have so much of a reference of what it was before, but I can, tell you about my experience. I was an intern at Harvard, and it had just been the Boston Marathon bombing, and so I came to a very serious and kind of solemn time. But it was just after that I had started. It was still kind of in the rigorous aspect, and it had just started the 80-hour work week, so everybody was learning about that and adjusting. And there was a lot of, my back in my day, things were harder. I had to walk uphill both ways.
It's still uphill both ways.
And but it was excellent training. Internship, especially as a surgery internship, I think no matter when, is difficult.
Sure.
You're at the bottom of the totem pole, and you really don't know very much, so you're relying on all of your the chief residents and the other doctors to teach you and guide you and have you do a lot of work. And so it's hard work, and you learn a lot. And I had a really excellent experience.
Obviously, wonderful institution, great name, and I think they did well by choosing you as one of their surgical interns. It reminds me just back for that transition. When I was a medical student, you really feel like you've kind of excelled, and then you kind of get into these highly competitive residencies, and then you realize how much more there is to learn. And this kind of moment where you're like, wow, these are real people and real problems. And not that medical school doesn't kind of prepare us for those types of things, but it's a little bit different when, you're given this privilege of applying the things you've learned to people. And I really see it even today as a privilege that we get to apply our knowledge, our talent, the motor skills we've learned with our hands, all of these things to making people's lives better. And I remember as an intern, that was a really special moment. I'm sure you kind of had some of the same experience.
Absolutely. I think that one of the biggest things that you learn from your chief residents, the residents who are older than you, and the attendings that you work with, especially as an intern, you're so impressionable, is the work ethic. And I learned that as there's a tremendous responsibility and a profound sense of responsibility to always do the right things and to take care of the patient and always put the patient first. And so those mentors that I had helped create that and imbue that into me. And that's probably ultimately, when I look back on it, of the things that I learned, the most important thing that I learned from my internship.
I feel exactly the same way. And you mentioned the Boston Marathon bombing and, really sensitive time. And it also kind of it makes me reflect back upon, when I was at PGY5, and that, for the audience that aren't residents or medical students or doctors, that means you're in your fifth year of postgraduate training. So 5 years after medical school. Again, you're a doctor, but you're training to be a plastic surgeon, you're training to be whatever specialist you're in. I remember that was the World Trade Center bombings, and it was one of those moments. I had just come out of the OR with my chief, the chief of plastic surgery, and we just finished a case, and everyone was kind of gathered around the TV, and I said, "Well, what's going on?" And they said, "Well, a plane just crashed into the World Trade Center, and there's this terrible like accident." And I said, "That's weird because that's not the flight path for airplanes in New York." And the minute I finished saying that word, the second plane hit, like while we were staring. And I remember this just sense of dread. And I just bring it up as a co-shared experience because I remember that it was just this mobilization, this activation that even though Yale is in New Haven, Connecticut, and about an hour and a half from New York, we were like, okay, we are now on mass casualty protocol, and no one's going home. And even as a PGY5, I was assigned a team and a ward and an operating theater to operate potentially independently because we were expecting these mass casualties. And so it's kind of poignant that in these moments of crisis, that's when that physician, kind of really comes out. They're like, okay, I'm here for people, and at whatever personal sacrifice, time, energy, whatever it takes, we're there for people. And so it's sad that sometimes it comes out the most in moments of tragedy, but yeah.